Hello everyone, today we are going to continue our cardiology lessons. So, in the last video we had seen about left heart failure, and now I am going to tell you about right heart failure. So, what happens in right heart failure, or what will the patient present with? What are the symptoms of right heart failure? So, if you see here the symptoms. So, before going into the symptoms, it will be much more easier if we know the pathophysiology. The right heart so this is the right atrium, and here we have the tricuspid valve, right, and this is the right ventricle. The outflow tract of the right ventricle is the pulmonary artery. And the inflow tract to the right ventricle is from the right atrium. This is the tricuspid valve. The right atrium is pulled by SVC as well as the IVC, that is the veins, inferior vena cava and the superior vena cava, SVC and IVC. So, the deoxygenated blood comes from all throughout the body, comes from through SVC and IVC, it enters the right atrium, and via the tricuspid valve it enters into the right ventricle, and the right ventricle pumps it to the pulmonary artery such that the pulmonary artery takes it to the lungs and it gets oxygenated over there. This is the concept. So, when there is a right ventricular pathology, when the right ventricle is not able to pump blood efficiently into the pulmonary artery, then there is stagnation in the right ventricle, isn't it? So, the stagnation or the pressure is being transmitted to the right atrium, and the pressure is being transmitted to the right atrium. The same pressure is being transmitted to the SVC as well as the IVC. So, when the pressure is being transmitted to the SVC and IVC, it is in pressure, right? The venous channels all throughout the body, the pressure is transmitted, and all throughout the body the venous channels are under pressure. So, therefore, when a tube or else when the vein is under pressure, then because of that there will be a transudation of fluid from the vein to the body or to the interstitial tissue. So, they will mainly present with edema all throughout the body. So, starting with pedal edema. And the second thing is the SVC and the IVC, they are draining the main important organs like the liver or the spleen. So, those organs also cannot be drained. The venous blood from the liver has to get transmitted to the SVC, has to get emptied via the SVC and IVC into the right atrium and the right ventricle. It does not happen. So, they can also present with the hepatomegaly. Similarly, the spleen, the venous blood from the spleen also gets stagnant, and they can also present megaly. But the most common symptom will be pulmonary pedal edema. Sorry, it is pedal edema. Then all these are associated findings. If you are someone who is preparing for MLE exams, then hepatomegaly, splenomegaly will all be omitted. They will mainly be concentrating on pedal edema. The second one that they will be concentrating is when the pressure is high in SVC as well as IVC, then what does it mean? The venous pressure is high, right? So, the central venous pressure, that is the central vein which is draining into the right atrium. We usually measure the central vein pressure, right? So, the central venous pressure will be high. How will the jugular vein be? The jugular vein will also undergo distension, because we are talking about the veins, the central vein, the internal jugular vein are all the same. So, the jugular vein will undergo distension, and the central venous pressure will also, the pressure will be high. Now, to tackle these exams, they will clearly know whether we know the normal jugular venous pressure or not. Normally the jugular vein will be 3 centimeters above the sternal angle. That is what the normal. So, to know that the jugular vein is under pressure, or the criteria for jugular venous distension is more than 3 centimeters above the sternal angle has to be the criteria. because sometimes in exams they will give you like the patient has a jugular vein distension that is about 3 centimeters near the sternal angle. That is normal. They don't mean to tell you about the right heart failure. They are just doing that to test your knowledge about the jugular vein distension. Now, what is the most important cause for right heart failure? What is the most important reason for right heart failure? The most important reason for right heart failure is the left heart failure. When there is a left heart pathology, it gets transmitted to the right heart. When there is a left heart pathology, it gets transmitted and therefore it will result in a right heart failure. So, this is in crux, in very small, the just real basics about right heart failure. Let us go to congestive heart failure. Let us talk about congestive heart failure. Congestive heart failure is another term which is used when both the right heart failure as well as left heart failure happens. It is known as congestive heart failure. So, they will be presenting with both the symptoms. We now saw that the right heart failure symptoms are especially pedal edema, increased jugular venous pressure, while the left heart failure presents with dyspnea and increased pulmonary capillary wedge pressure. When both these symptoms are given, we should be aware that the congestive they are hinting towards congestive heart failure. With this, we have just brushed an overall about right heart, left heart failure as well as congestive heart failure. See you in the next video. Bye.